Hello, everybody. Thanks for joining us. I'm here with Julie G. Julie, thanks so much for lending your expertise as always.
Yeah, happy to be here. This is an important topic.
Yeah, so I think we're all on the same page here that throughout my career, and I'm in my 70s now, so this has been a long time dealing with patients with different issues. I've seen a lot of changes, and very excited. I was interested in history of medicine when I was in medical school, and was actually a history of neurology scholar in medical school. So to see things like what happened when the chest X-ray came, what happened when mammography started, what happened when the Pap smear started. These have all saved thousands and in some cases millions of lives. And I think we're very much at the same point here with these new tests. For the first time now, we can look, we can actually pick up very, very early changes for people who are asymptomatic. For people who are already symptomatic, it's also helpful because we can now follow you. So for the first time, we can look inside the brain without doing a PET scan or an MRI and actually see the biochemical processes. And we'll talk about these today because we're looking at three different complementary pieces. One is whether there is any of the signaling that we associate with Alzheimer's disease, and we can pick it up again very early. One is whether there's any inflammation and repair going on, and then the one is whether there's any neuronal damage going on from whatever cause. So these are three very complementary sorts of things that you're going to look at. And let's just go through these. And let me share my screen here. So here we go. So let's take a look. There we go. Okay, so hopefully everyone can see that. Let me put it on presentation mode here. So the point here is that there are many advantages, and everybody should know, just as we should all know our blood pressure, just as we should all know our lipid panel, just as we should all know our ApoE status, we should all know our status on these tests, all three of them, but starting with this high sensitivity p-tau. And what I mentioned is high sensitivity because it does set itself apart from the more standard sensitivity p-tau tests, which in the past have been used. When I say past, I'm talking about in the last just 12 months that they've been available. They've been used for people who are already with significant symptoms. Now, what's happened here is it used to be that we could only look and say you have diabetes or you don't have diabetes. Now we can say, oh, before that, you're going to get some insulin resistance. And you can even get the beginning signs of insulin resistance and biochemistry of insulin resistance many years before you ever have true diabetes, so that you can treat it then and you can make sure that you never get diabetes. Same thing going on here. We can now pick up the p-tau 217 thanks to Neurocode and Dr. Hans Frickman and his team, which did such a great job. They use a specific instrument called ALTS-PATH, which very few others use. So they have the ability to pick this up very early so that we can make sure that nobody or virtually nobody ever gets to the point of actually having dementia. And that's what we're all interested in. Let's have a world with less dementia. So let's go through some of the basics here, the background, and then let's go into taking questions. So the topics we're going to go over today: what is p-tau 217? How do I get it? High sensitivity p-tau 217 versus competitors who are doing a lower sensitivity assay. The emotional aspects, and I think Julie has brought up something really important here. There are issues, and this happened many, many years ago with Huntington's disease. Do you want to know? Do you not want to know? This is an important thing. In this case, the key here is we can do something about it. So it's a really good thing for all of us to know. I'm actually going to be getting mine drawn next week. What are the benefits of doing the test? And we'll talk about those. How do I get it? Easy to do, and we've actually got a QR code that you can use here. And then we'll take some questions at the end. So let's get right into this. So what is this? So what happens is tau is a protein. And when you make neurites, when you send out your neurites, when you make connections in your brain, and you have about 500 trillion of those, then the p-tau or the tau stabilizes the microtubules. So when you're putting out these structures, and just like putting out a structure on a house, you're going to want to have some strong beams, and so you use microtubules. You got to have bolts for those, and the bolts are the tau. That bolts these things together. Now, when you want to send a signal to say, uh-oh, things are not good, I want to change my resources from connection to protection. I'm going to pull back, very much like what happened with our country when we had the pandemic. Like, okay, shelter in place. We're going to pull back now, and of course, we went into a recession. So when your brain is sending those signals, the information saying something is wrong, we may have some inflammation from a leaky gut. It might be from a chronic infection. It might be from a change in your oral microbiome. It might be because you have sleep apnea. For whatever reason, when you're sending that, you now want to pull this back. And the way you pull those processes back is you phosphorylate your tau, which changes its shape and pops it off the microtubule. Now the microtubule can collapse quickly and you pull back. So when you're seeing this going up, it's saying, hey, there's some signaling in the brain that's starting to pull back. Great, we can follow that as we then treat the things that are causing it, make you better. So you should never notice the problem. Now, if you've already got symptoms, you'll start noticing an improvement as your p-tau is coming down and your cognition's going up. So this gives us, for the first time, the ability to look biochemically into what's going on in your brain, just with a simple blood test, which is really fantastic. It is truly a game changer for that reason. So it'll allow you to avoid things like PET scans and a traumatic spinal tap and things like that. Okay, how do I get it? We put this together as BrainScan by working with Neurocode to get better pricing and to get this. This is really the best of breed test. It's called BrainScan. It's a simple blood test. It includes 3 different tests, as I mentioned. You're looking at high sensitivity p-tau 217, which tells you whether there's any signaling related. You may have pre dementia, which is fine. Don't worry about it if you get it. We know that we can improve this. We can see that coming down. So great way to follow it. Neurofilament light, as I mentioned, is looking at if there's any neuronal damage. It could be from a car accident. It could be from a bike accident. It could be from vascular disease. It could be from a different neurodegenerative process like frontotemporal dementia. And then GFAP, which is really nice because it's a highly sensitive one also. It's very early. You can look at changes, and what that reflects is inflammation and ongoing repair. So it's the activation of your astrocytes, which are the cells that support your neurons. Okay, so why do we like this particular one? For these reasons. First of all, it's a high sensitivity one. There's only one other one which is got that same sensitivity, and that's about almost twice the price of this one, unfortunately. The other ones are less sensitive, unfortunately. So we definitely want to make sure that we look as early as possible and in as sensitive a way as possible. Second thing is you don't have to pay for a doctor's visit. You can get this directly. And this is, again, part of 21st century medicine for all of us to know where we stand, to have privacy with our own information, and to be able to control this and then decide, okay, we're going to go on the protocol and we can actually follow it as time goes, which doesn't mean you can't tell your doctor or interact with your doctor. It simply means that you don't need to schedule a separate visit for that, which is really nice. And as I mentioned, it gives you the privacy. So let's talk about the emotional aspects. And as Julie has pointed out, there is an emotional ramification, of course, just as there is to learning your ApoE status. And, sadly, much of mainstream medicine says, don't check these things because you can't do anything about it. But we know now, and from multiple trials, that there is a tremendous amount you can do about it, and we all should be finding out. So I recommend anyone who is 40 years of age or older, find out your ApoE status, find out your p-tau status, and then get on active prevention or earliest treatment. And then, as Julie has pointed out here, make sure you have a strong support system. So yes, talk to people in your family. I mean, you may, ultimately have, especially if ApoE4 is in your family, you're going to want other family members as they turn 40 to get this as well. And understand that these things are going to go up a little bit over time with age. But again, please don't worry about it. This is something you can do something about. Again, it's like finding out that you have pre-diabetes. There's a tremendous amount you can do about it so that you don't ever have to get all the side effects of diabetes, all the many problems that you get with full-on diabetes. And then if you do get a result that's a little bit high, again, please don't worry about it. You will be contacted. We will make sure that we get you on the right program so that you can bring this down over time. And consider Recode, because that was what was developed for reversal of cognitive decline. Also, it's very good with prevention, and that should bring your testing down over time. Now, one thing we have noticed, we're doing this same test for our ongoing clinical trial. If you lose a lot of weight very quickly, it'll bump up a little bit just because of the weight loss. But don't worry, as your weight gets stable, then it's going to come back down again. So please don't worry about that. It is simply related to a sudden loss of weight. So what are the benefits? Lots of benefits.
I'm
Yeah,
gonna
please,
jump in
please
for a
go ahead,
second.
Julie.
Have you had this test?
Yeah, so actually it's scheduled for next week, and I just heard about this a few minutes ago. So I'm
Oh,
excited about that, and I'm excited about knowing. And of course, we've just talked to a number of people, such as our mutual colleague, Dr. Ram Rao, who's
sure.
just gotten his results. And I think it's a good, also, of course, Lance Kelly, our colleague, has gotten his results. This is power, as you say, knowledge is power. These are things we should all know, just like knowing your blood pressure, your ApoE4 status, your homocysteine, your HSCRP, your insulin sensitivity, these things. And I always separate them into this tells you if you have these processes going on. Do you have something where you're actually headed for Alzheimer's? Might be 10 or 20 years down the road, but you can do something about it most easily now. And then the cognoscopy part, your homocysteine, your HSCRP, that tells you why. So one's about if and one's about why. You put them together, very powerful, because you can say, am I having these changes? Here's what I can do about it to make sure I never have this. My hope is that if everybody does the right thing, their dementia will be a rare problem, which is exactly what it should be. Right now, 15% of our population is dying from Alzheimer's. And very few people need to have that happen. It's kind of a vestige of an outdated system where everybody waits until they're way down the road, goes into the doctor who says, there's nothing I can do for you. You're going to die of Alzheimer's. And because of that, 45 million of the currently living Americans will die if we don't get these tests earlier, get on this earlier. We can prevent and often reverse, especially in the early stages, the vast majority of this problem. And that's what we should be doing. So, as you say, Julie, knowledge is power. And knowing your status gives you the opportunity. I mean, look in your own case, when you found out that you were ApoE44 all those years ago when you were in your late 40s, look how it's changed your life. I mean, you've had so many ongoing, and my hope is you'll have until you're 100. You'll have the superb cognition that you do have and that you have had for years because you were empowered with knowledge instead of just waiting. So I think that this is where it's going to change. Again, it's like, do you want to avoid a pap smear? Do you want to avoid a chest X-ray? These are things that can help you to have longer, healthier life. Same thing with a colonoscopy. These things are all there to save lives. So, and as you say here, the knowledge is going to help you to set priorities. What I really like also is it's a tracker. It gives you a number at the beginning. And then we often want to know, are you doing better in terms of your cognition? But we'd also like to say, is your brain biochemistry doing better as you start to come down? The other thing is none of these other tests provide you with a report. It just says, here's your number. Boom. So we have a personalized report. It will look at your values and tell you based on your values what is appropriate for this, which one was high and why, what it means, what to do about it. So this is another key piece. Again, as we are in 21st century medicine, as we're understanding more about our own health, we want to know what to do about it. What are the things that we can do to make things better? And again, we should get to a situation in which the world has very, very few cases of dementia. And then finally here, if your test results are out of range, you'll get a nationally board certified health coach will reach out to you. And that's huge. So, you'll be able to, get rolling. And so, again, this is something where all of us can really benefit from this. So, Julie, what should I add here?
You've talked about a lot of the most important things, but I think we can't overestimate the fear
Yes.
that people are feeling about this test. I like the analogy to diabetes, but this is your brain. This is the essence of who you are. And mainstream medicine says there's nothing that can be done about it. We, Dale, know that's not true. I personally know that's not true because I previously experienced cognitive decline and I've been able to reverse it. But for that very reason and my ApoE4 homozygote status, I'm afraid to take this test. And I'm guessing that a lot of people that are joining us today are feeling the same way. I am going to take it though.
Yeah.
And part of me is excited. I
Yeah.
anticipate I'm going to get some high p-tau numbers. As you know, I've been caretaking for the past few years.
Yeah.
I've not been able to follow the protocol as much as I would like to. And I'm going to use this as an opportunity to reset my life.
Yeah.
So I want people that are considering this test to feel the same way. Be aware there's something that you can do. Be prepared for bad results. If you get good results, fabulous. But if you don't, be prepared for that and get ready to make yourself a priority, to take care of yourself, to get on the protocol and turn things around because it's absolutely amazing. It's a brave new world, and we have control over our health. It's
You know,
really
it's so interesting to me. Everything now is about AI and about Ozempic and about Taylor Swift. There's just these few things that are everywhere, right? And the thing is that knowing your status on this test is more important than any of those
great.
because it's going to impact you directly, and it gives you power to do something about this. It basically says, look, you could have problems in the future. Let's deal with them now. So here's my guess from everything we've seen about this test and that I know, and you and I have interacted now for years. When you first had problems, your p-tau was definitely going to be high. That's pretty clear. You knew your husband even mentioned to you that he could tell differences when he would go and come back. You then started treating yourself beautifully, and you were clearly doing better and better with your cognition. You went from 35th percentile to 98th percentile. And so, in all likelihood, your p-tau was coming down, coming down, coming down. And my guess would have been after you dealt with the excuse me, the babesia, and then you
Sure,
dealt with the mycotoxins. My
sure.
guess is it would have been normal by that time because you had really gotten all the things that are causing this signaling. Now, as you said, you've now been doing some family caretaking. You've had a little more stress in your life. So, yeah, I wouldn't be surprised if you tell me it's bumped up a little bit
Sure.
because you've got the ApoE44, as you mentioned. So, yes, it may bump up a little bit, but don't worry. We'll get it back down as you again focus on the things. So, it's essentially like saying, do you want to drive with it being able to see out the front window, or do you want to drive blind? It's much better to be able to see where you're driving, and that's exactly what this provides you with, the ability to see where you're driving and not to have a crash. And so you can pick up things as they're starting to drift up, like, oh, wait a minute, maybe I have been exposed to something new. And as you know, we just published a paper, and actually you were part of this, published a paper. It's freely available online of 10 of people who had been on for years and have done very, very well. And of course, your case history was one of them. And so we have people that were over 10 years that had had sustained improvement. And yes, some of them bumped up and bumped down as they discovered things that were driving it or not driving it. So I think we're understanding better and better that not only can we make people better, but if you do the right things, you can stay better for many, many years to come. So
Absolutely.
let's see here. So here's how do I get it? Here's a QR code that you can scan, and let's see how we're actually doing well on timing. So we can take some questions here. But please take a look at this. You can also just go to getabrainscan.com, and that will allow you to get this. So this is something that's never before been available and is really going to take us all to the next level. We do have to, again, boy, I've got some, need to have a little water here. Okay. We have all been living in a world, and I was trained in a medical world where you wait until these symptoms come on and then you do what you can. You have someone who's just had a stroke. What do you do? You have someone that's just been diagnosed with Alzheimer's. What do you do? We're now entering a new world, 21st century medicine, where we can see these things coming and make sure that they never happen. So this is really a time, I think, to celebrate. We probably should have broken out the champagne here, because that's really, this is a good thing. So I'm going to stop the share there and let's switch over to some questions and answers. And let me pull this up here to the Q&A. Okay, so let's go through these. All right. So here's one from David. Says, I'm a candidate for the Recode program, 81, have ApoE44, and have a brain volumetric MRI, shows them a single-digit volumetric hippocampus volume percentile for my age. Okay. By the way, we've had people go from low percentiles to much higher percentiles in some cases. So please don't give up. We don't yet know whether this is because of more stem cells, simply because of more synapses, but for whatever reason, we have seen it go up. And by the way, we saw improvement in the overall gray matter volume in our previous trial, even though people already had MCI. So, okay, says, I test low on the MoCA type testing. Okay, it doesn't say how low. Neurologist. Oh, here,
24.
MoCA score 24. I see that. Okay. So
Yeah.
many, oh yeah. So the MoCA score of 24, that is MCI. That's not terribly low. It's consistent with MCI, just what you say here. So what additional information will we learn from BrainScan? Great. So you'll learn three things. Number one, you'll get a p-tau and it'll tell you whether this is definitely Alzheimer related. And it will tell you, here's your baseline. Now you can follow it as you do the right things and get better. So it's extremely valuable as something to follow. The second thing is it will tell you whether you have ongoing inflammation. The GFAP part will tell you that. And again, you'll be able to see that as you deal with that inflammation effectively, you'll be able to see that. There's been no way in the past to say, is my intracerebral inflammation going down? There was no way to do that. Now you can actually see that. And then the third, it'll tell you, is your NFL high or is it low? Is there some neuronal damage? Not just signaling, not just inflammation, but actually neuronal damage. So three complementary pieces of information for you. Okay, next one here is from Anonymous. Have any of the people been doing protocol for years, seen their levels as normal? I understand they don't have a baseline. Yeah, so absolutely. We see people getting lower and we see people coming into the normal range. We've already seen examples of that. Next one here is from D, who says, my p-tau 217 result yesterday shows 0.43. How do I get it? Okay, first of all, you're in that indeterminate, which is good. So it's not high, but it's saying it's creeping up a little bit. So let's get you down. Okay, fantastic. What can you do to get it below 0.34? Recode. That's why we developed Recode. It's going to be the basic 7: diet, exercise, sleep, stress, brain training, detox, and some targeted supplements. And then the specifics. Do you have specific pathogens, specific toxins? So get involved with a Recode practitioner, whether going through a coach, whether going through a physician. Get involved with a good team. We're seeing again and again that having a good team behind you really, really helps. The other thing we're seeing, by the way, is that support groups are helpful. And I know Dr. Dean Ornish mentioned this in his recent publication as well. And so interacting with things like apoe4.info, really, really helpful to get things. So, Julie, I know you've interacted a lot. You're the website that you founded, the apoe4.info. Have people reported there that they have brought theirs down, or hasn't it been out there long enough to know?
It's not really been out there long enough. In apoe4.info, we have a handful of members that are in clinical trials for the
Yeah.
anti-amyloid drugs. So they've done the Precivity 82. So in order to be in the trial, they know it's high. And
Right.
I have to tell you, these folks are so cognitively sharp.
Yeah.
So if you get a high result, do not panic,
Yeah.
because the correlation between that high result and your cognition is certainly not 100%. And as Dr. Bredesen has mentioned, it just gives you an opportunity to see what's coming down the pike if you don't turn things around. So we've had a few people do it through LabCorp and Quest, not understanding it wasn't as accurate or sensitive. So people are still trying to wrap their heads around this information. But, as more people learn, they're going to be sharing. You've got a Facebook page that's amazing called the Official Bredesen Protocol Facebook page. Anybody can join. If you're a member of Apollo Health, we have amazing forums there. You can join apoe4.info. But definitely, and we can all be support for one another as we do these tests, as we talk about what to do about them and all that kind of stuff.
Yeah, it's a really good point. And again, 80 million Americans have metabolic syndrome. So that means that you're typically have insulin resistance. You may even be heading for type 2 diabetes. You have some vascular disease. This is something that, if left unchecked, increases your risk for Alzheimer's, increases your risk for vascular damage, and of course, diabetes. So finding out early that you're at early metabolic
Yeah.
syndrome, you can get rid of all this problem. This is the future for all of us to find out these things with chronic illness. This is the Achilles heel of chronic illness. It can tell you, if you know what to look for, then it'll announce itself early, long before you get symptoms. So don't wait for symptoms. If you do have symptoms, of course, with p-tau, follow it down as you do better. So again, this is offering us a new piece of control that allows us to get better, allows us to have better cognition. As Julie said, there are people who are high on their p-tau. Cognition is perfect. Great. Let's
Right.
keep it that way. Let's bring it down. And what'll happen is you'll never have to worry about this in the future. So that is, again, the beauty of these new tests. Next one here is from Anonymous, says, I just started treatment for relapsed follicular lymphoma, non-Hodgkin's. CRP has jumped up, wondering if this disease and treatment would skew the BrainScan tests. Should I wait to take them when I hopefully go into remission? It's a good point. So if anything, it may skew the GFAP a little bit if there is brain-related inflammation. So you could do it either way. You could check it now and then follow it down as things get better, or you could wait until you go into remission and you could check it at that time. But again, please don't worry about what you see. It's simply telling you these are the things that are now that are warning signs that you can now improve. And then another one says here, another person says, if you're ApoE44, do you still need to be aggressive with Recode if your results are normal on BrainScan? This is a
First,
great
yay.
question.
Yeah,
Yeah,
that's
great
wonderful.
question. So if
Yeah.
you're ApoE44 and you're normal on BrainScan, hallelujah, you are doing
Yes.
things right.
Yes.
We do have examples, and I just finished a book that'll be out next year, March 25th, which is about the aging brain. And we talked about a guy who's 100 years old, ApoE44, and has very good cognition. So it happens, absolutely. And this paper that came out recently and said, oh, everybody who's ApoE44 is going to get Alzheimer's, none of those people were doing the right things. They were all on the standard American diet, doing the wrong things. And of course, that's a problem. So hallelujah. And what you can do is, if your results are completely normal, you can ease up a little bit on the protocol that you're doing, but check it again in a few years. So what we recommend is check it at 35, 40, 45, 50, 55, 60. And then when you get to 60, more like every 2 years, and make sure, and if you see it coming again, you see things going up or your cognition coming down, Boom, you don't have to wait. This has been the big problem in the past. Everybody waits until things are very severe. You don't need to do that. So yes, you can have some sweet potato and don't worry quite as much. But remember that you've done a great job so far. Don't mess up your great results. Don't get too far off it. Don't get into the brownies and pizza quite yet. Okay, let's see. The next one here. I'm 80, have zero ApoE4, zero cognitive issues. Do I really need this test? Yeah, so I'm 72. I hope I don't have cognitive issues. I'm ApoE4 negative. I'm absolutely getting the test because I want to see where I stand. And it's also going to tell me not just about Alzheimer's, it's going to tell me about inflammation, and it's going to tell me about any neuronal damage. And, I played some football and a very, very horrible football team as a safety. I had some head trauma. That was many, many years ago, of course. And I spent about the first 65 years of my life eating pizza and brownies and all the stuff that you eat when you're trying to stay overnight and take care of patients multiple days in a row. I have a couple of extra pounds I'd like to shed. So I'm absolutely checking mine. So I think, again, I think it's a good idea for everyone. And, it's great. We've just in the last 2 minutes here seen someone at high risk, someone at very low risk. Okay. But we all want to know. It's just like saying, should I still check my blood pressure? Absolutely.
Mhm.
Okay. So Lisa says, I didn't hear how Julie improved her numbers. Yeah, she put this in the book. She wrote the handbook for the end of Alzheimer's program, and she showed she went from 35th percentile to the 98th percentile. So she's done absolutely fantastic. She is a fantastic role model for all of us. My wife, Aida, often says to me, Dale, you and I need to be more like Julie. And she's right. She's absolutely right. Julie is a great role model for all of us. And then Barbara saying, say the test is not a good result. Other tests that need to be done in ballpark cost. Great point, Barbara. So again, as I said, these tests tell you if they tell you, do you have it and what's your status? Then you want to know why. So you want your homocysteine and your glutathione and your HSCRP and your HOMA-IR and your mercury. Then you want to know, okay, something is not quite right in that network sitting in my head. What can I fix about that network? And Julie, maybe you could talk a little bit about your recommendation. So for in your group, which I guess is what, over 8,000 now, something like that, that you've got an awful lot of people on apoe4.info, which is fantastic. What do you tell them when they say, okay, I'm having some early symptoms or I'm having an abnormal test? What then do you do?
Well, we start with the basics. We try to identify what are this individual's contributors. Is it sleep apnea? Is it metabolic syndrome? Is it exposure to mycotoxins? What is it? And obviously address those contributors. But at the same time, as you mentioned, we need to do the Bredesen 7. And those are the foundational steps to just support brain health and promote neuroplasticity. And as you mentioned, that's a healthy diet, exercise, sleep, managing stress, stimulating your brain, working on detox, and taking targeted supplements. So we need to target what's wrong, and we need to generally support the brain and give it a fighting chance to heal.
And here's another great outcome from this test. Let's say that you do those basics and things still aren't improving. You know that there's something being missed. And often we do.
Exactly. Yeah,
And
you've missed them. Right.
exactly. And so,
Yeah.
and I hear this all the time. Someone's having some issues, then it's not
Sure.
getting better. And then I say, well, did you do this test? Did you do this? Actually, Julie and I went through this a few years ago. And it turned out in your case, it was babesia. When you first found that,
Ah,
oh, wait a minute, there it is. There's the thing that's
right.
driving this. So
Right.
you want to look at the pathogens and toxins. But as you said, you start with those basic 7, and then you go to the specifics. Robert's got a great question. Once you get the test results, what's your process for explaining the results and designing a protocol? Absolutely. So that's the whole point here. We have, with the results, you will get an explanation that is fitting for your results, a personalized explanation. And then you want to get on Recode, get on treatment so that you can now start to bring this down. Now you can follow not only your improvement in cognition, and if you want, you can also follow your hippocampal volume, but that takes longer to change. But then you can now also follow the biochemistry in your brain. Is my GFAP coming down? Is that inflammation coming down? Is my p-tau 217 coming down, showing that things are getting better? So the whole point here is there is something that can be done about it. We've seen it repeatedly. We've published it in hundreds of people, and so that you can then use this. This one says, this is Sue, my p-tau is 1.03. Okay, so please don't worry about it. That's a little high, but it's not that high. And so now you've got your baseline. Now let's make sure you're doing the right things. Now, if it doesn't start to come down over the next, you want to recheck in typically 6 to 12 months. We have checked people even at 3 months. It's probably a little bit quick, because what we're finding is some of them have lost a lot of weight as they started the protocol. And so their p-tau bumped up a little bit, which is understandable. So yeah, 6 to 12 months, follow it. If it's still at 1.03 and you're doing all the right things, okay, then we need to look and see there's some infection, chronic infection that's been mixed, or there's some toxin. It may be an inorganic toxin, organic toxin, a biotoxin. Again, we will walk you through all these things. Your practitioner will walk you through these things to make sure that you get on the right things and get the best outcomes. Some people, we just had someone who's improved, and they improved and they improved, but then they kind of plateaued. Okay, they just went and got stem cells recently. We'll see how it goes now that she's had the stem cells, and I'm very interested to see how that goes. And others have had stem cells and hadn't seen some improvement. So getting this whole network to function optimally again is the goal. This is from Carolyn, who says, just received my results from the blood test. So relieved that the test was normal with the exception of GFAP. Okay, so you have a little bit of ongoing inflammation and repair in there. The good news, GFAP is also about repair. So you've got some repair going on. A little bit like, finding your cholesterol is a little high. Okay, there may be a little bit of vascular damage. You can do better over time. Do I need additional assistance? So I would definitely get on the protocol to get now, if your GFAP is right on the border, yeah, I wouldn't worry about it. You don't mention what the actual GFAP is, but if it's high, I would get on the protocol, and I would, again, this pushes you toward what? So you want to focus especially on the things that are lowering the inflammation. So talk to your practitioner about resolvins, talk to your practitioner about omega-3s, about pregnenolone, about pectisol, about curcumin, about ginger. These are all the things, sulforaphanes, all these things that are helping you. The sulforaphanes will help you detox, but so many times biotoxins are contributing to that. Yeah. So I would say, yes, let's get your GFAP down, because we want you to have a functioning brain to 100. Once you get to 100, you're on your own, but we want to get you to 100 and doing really, really well. Okay, next one here.
Wait, I just want to say something. We should tell people how to get on Recode. So yeah, we have an amazing company called Apollo Health. You can find it at apollohealthco.com. You can learn about the Recode protocol, how to join. You can also buy the End of Alzheimer's program if you want to try to do this on your own. But if you've got those high numbers, you probably need that trained practitioner. You may need a health coach, and you may need the assistance of the community and access to Dr. Bredesen himself through town halls and things like that. So Apollo Health is how you get Recode. So if anyone's worried, please come and check that out.
Yeah. And Julie, I think your guides are now over 100. Is that fair to say? You've got a lot of wonderful guides in there. I don't know the exact number, but you've got all these.
I'm sure there's way more than 100, but we really try to hold your hand and walk you through every step of the protocol. And we're constantly honing how we do that, and we're making it better and better. But we want you to be successful, and that's the most important thing.
Great. Next one is from Jonathan, is just asking about how it compares with LabCorp. Yeah, and this is what we were showing earlier, that this is more sensitive than LabCorp. This is more sensitive. It's more privacy. You don't have to go to see the doctor, and it provides an interpretive report that the other one doesn't. So those are the main differences. So I mean that would be why. That's why I'm doing this one. We could do any one, but this is the one that we're doing because it has those features. Next one here is from Karen. Any reason for 86-year-old to get this test that they just had a MOCA done and it was 11? Lives independently and is a whiz at solitaire and jigsaw puzzles. Fantastic, but definite memory issues. Yeah, this is a good point. So for someone like this, the idea is if you're going to treat now, if you're not going to treat anything, you don't need to do it. If you're going to try to make this person better, if you're going to try to help them out, then you want to see is their cognition is improving and is their biochemistry improving? In other words, is their p-tau coming down, their GFAP coming down, their NFL coming down? So if you're going to try to make them, to help them so that they don't, you mentioned a MoCA of 11, at some point, once you get below about 16, you get into this accelerated phase. This is presumably because prions amplify themselves. So you get into this accelerated phase where it's 11 and then it's 6 and then it's 1 and that's 0. So if you're going to try to keep this person doing well, you want to reduce their p-tau. So that would be the reason to get that one. Susan says, my husband had blood test, plasma, see, p-tau 217, plasma FUJ01 result 0.15. So it doesn't tell me which one. Some issues, early Alzheimer's. Okay.
This
Nine.
might be the LabCorp platform, I think, is a Fuji, might be a different test.
Yeah, and I've seen one recently that was off the charts high, and just repeating it with a reputable group, it was normal. So be careful. Everyone, it's a little bit like Ozempic. Everyone's now jumping on Ozempic, making their own, be careful. There are some that's not so great. Now, I understand you say here that there were hemorrhages in the brain, microhemorrhages. So this is presumably some amyloid angiopathy. And so, yes, they wouldn't be doing anti-amyloid antibodies, but you should absolutely do Recode protocol. You don't want to take a lot of blood thinners, so I would stay off high-dose omega-3s, for example. But doing the right things and getting the right diet, all these things, this is exactly what this is set up for, and that should improve things. How do you test for metabolic syndrome? So that's part of the Recode report as well. You'll see if you have metabolic syndrome. It's the combination of insulin resistance, often with some obesity or at least extra truncal weight, then typically with hypertension, and then typically with an abnormal lipid profile. So you'll have a high LDL particle number, you'll have a high total cholesterol, a high LDL, those sorts of things. So it's that combination. And then over time, that'll damage your liver. So then your ALT and AST will go up as well. So that's metabolic syndrome, and you can check for it easily with the labs that are done as part of this. Let's see here. Donna says, while not being in ketosis, but following a lot of the protocol with good CRP, good homocysteine, low-carb diet, exercises in ApoE44, female of 70, should I suspect my p-tau to be elevated? Well, the p-tau actually reflects very closely the amount of amyloid that is there. So she says, like Julie, I'm a group that says, I'm nervous about taking p-tau. And everyone talked together about this because it's something we should all be doing together. And I think it's a very, very good point. And that's why there was that slide about the ramifications. I totally hear you. And it's something to think about. The great news is, hey, for the first time, there's a tremendous amount you can do about it. So please don't worry. If your result is normal, hallelujah. If your result is abnormal, what you probably want to do, think about doing a little more metabolic flexibility, getting into some ketosis, taking even some exogenous ketones to begin with, then getting into endogenous ketosis. So much you can do about it. Again, 7 million Americans who are ApoE44. I'm hoping none of them will get Alzheimer's. Let's get early for everybody, do the right things, optimize the metabolic status, keep the p-tau low, and let's make sure that nobody gets this. Okay, next one here is I did the test, have my results. P-tau and GFAP are elevated, but I'm curious to know how elevated could they be? In other words, are they just a little high? So, all right, let us know what you saw, because it just says how elevated, but it doesn't tell me a number. So yeah, if the p-tau is above 0.47, that's high. However, it goes up much higher than that. So please let us know, and we can look. But again, don't worry, we can bring this down over time. Next one here, Don says, my neurologist didn't know anything about BrainScan. Yes, this is new. That most neurologists don't know anything about how to improve cognition as well. I'm sure the neurologist probably knows about p-tau 217. So it says I
Maybe
got
not.
maybe not.
Read. Maybe
Some
not.
maybe. But yes, you have an opportunity to teach your neurologist something. So I got a blood test showing ApoE4 one copy. Okay, please don't worry about that. Says she wants me to get the lumbar puncture. You don't need to do the lumbar puncture anymore. That's the whole beauty of this. No PET scan, no lumbar puncture. You can go ahead and do this. Will give you the same results as the lumbar puncture. And again, up until about 9 months ago or so, when these blood tests first came out, you had to have either a lumbar puncture or a PET scan or both. So great point. Her lack of info is scary. So you're saying I should get BrainScan. Yeah, very good point. So I would simply show her that, in fact, the results. So the paper just came out. In fact, we should probably post this paper that just came out that said that p-tau is just as good as a spinal tap or or a PET scan at showing you these changes. It's just as sensitive. So I prefer a blood test over a spinal tap. Julie, do you prefer a blood test or spinal tap?
Blood test.
Okay, so that we all feel the same way, exactly. And by the way, I remember people when I used to do hundreds of spinal taps when I was training years ago, and people occasionally would get spinal headaches. They don't close that tiny hole, and that they keep leaking the spinal fluid, and they get horrible headaches for months. So yes, blood test better than spinal tap. So and then Lisa says, so ApoE44 is not a death sentence. Exactly. Absolutely not. And I'm so glad you brought that up, Lisa. It is not. And in fact, as I said, the people that were used in that trial to say, oh, look at all these people getting Alzheimer's, they weren't on the right protocol. So it's kind of like saying, so if I live in America, you mean I'm not going to die of heart disease? It's true. A lot of people in America eat, hamburgers and French fries all the time, have a sedentary lifestyle, have hypertension, do everything wrong, get metabolic syndrome, and die. You don't have to. You do not have to do that. Same thing with ultra processed food. Don't get us started. Julie's written a whole book about this, so don't get us started on this. Okay, next one's anonymous. My volumetric MRI showed my white matter is 10% for my age, 72 years. Gray matter's okay. Great. Which gray matter is most important? Will the test tell me any more? Yeah, so this test will tell you a lot more. So it's a great point because this is complementary. One is really anatomy that's telling you how does the white matter is where the oligodendroglia produce the myelin. So that's the connections. It's like the telephone lines. Whereas the gray matter is like the telephones themselves. This is the neurons. This is where they're sitting, the communicators, and then they communicate downstream. So that tells you that. This tells you these blood tests tell you the biochemistry. They're telling you what's actually going on. And this is what we studied in the lab for 30 years. You can actually see at the most basic molecular level, you can see why APP works the way it does, when it's going toward connection and making SAPP alpha, when it's going to protection and making amyloid beta. So you go through these, and if you've got the insults, you switch this into a protective downsizing mode. So this is what you're seeing here. Now, of course, you've got to find out what's affecting your white matter. It can be vascular disease, especially small vessels. It can be some toxins that can do that. Diabetes, hypertension, all these can affect your white matter. There's some very nice publications on this. So I would work with your practitioner and let's see if we can get your white matter doing a little better. All right, then here is from Peggy. How's this test different from 42/40 ratio? Great point. So the 42/40 ratio is what happens is you make a little bit of 42 and more 40 in general. And what happens is as you're now responding to this, you are using your 42 in your brain and less of it is getting into your blood. So your 42-40 ratio is actually going down. And that's telling you you're at increased risk. Something's going on. So that is an indirect reflection of what's going on in the brain. And Julie, I don't know how many people you've dealt with who have been looking at their 42-40 ratios.
Quite a few, especially those that have been in clinical trials. That's a
Yes. Yeah.
standard test. And I
Right.
think before the p-tau, quite a few people were getting that test.
Yeah.
But the p-tau is a game changer. It will directly show what your brain pathology is doing.
Yeah. So maybe you could just spend a minute and take all of us through your own personal decision and personal, wrestling with the issue as a person who's 4-4, who's doing very well. What were the things that you considered that led to your decision about taking the test?
As I mentioned, I'm planning for the worst. As an APOE 4-4, I've been a caretaker,
Yeah.
and my work schedule's been very hectic, very hard. That hasn't let up, while
Yeah.
my uncle and my mother have been very needy.
Yeah.
And so I haven't been able to exercise as much.
Yeah.
Stress has been an issue. And then when stress is an issue, we don't sleep as well.
Yeah.
So I'm not practicing the protocol as well as I want to.
Yeah.
I am fully prepared to recommit. I plan on backing off work a little bit, getting more family members to step in and help with caretaking and making myself a priority. I'm excited about it. I
Mhm.
see this test as giving me permission.
Yeah.
So if I get good results, hallelujah, I'm still gonna take a step back because I'm in my 60s. I'm a 4-4. I've seen the other side. It's pretty scary to have cognitive decline, and I
Yeah.
don't want to go back. I'm vulnerable. So it is a hard decision, but in some ways it's an easy one. Easy because I have a plan and I know what to do. And I'm sharing that with everyone today so that you can follow my example. Take this test at a time that's good for you. Make sure you have a good support system. Get your plan in place and get ready to get on Recode. And there's tons of support groups. We can support one another on this journey.
This is such a good point. Dr. Lee Hood, really my personal hero, writes about this idea of a wellness to disease transition when they follow metabolomics and they can see, oh, something has changed as a person is getting arthritis, for example, or the person is beginning to get vascular disease, for example, or COVID, any of these things. You can see this transition. And with these chronic illnesses, it takes us years to get symptoms. So being able to look earlier means everything so that we can actually see, aha, this is changing. And it tells us, just as Julie's saying here, oh, wait a minute, I have to live more normally. Oh, wait a minute, I can't burn the candle at both ends. I can't sit around and I can't work 24/7, which, I wish I would have known this when I was an intern all those years ago and I would staying up all night. Like, wait a minute, that's not good for you. So this is where this is so helpful. Now, Astrid here asks about what about taking the test once you've been diagnosed with Alzheimer's? Yes, because now you want to be able to follow it back down as you improve. So yeah, huge. Let's see. Miley is saying UCSD Memory Clinic just recently begun offering ApoE testing. Oh my gosh. Yeah, this has been around for many, many years. Too slow. They're moving slowly forward. That's better than backward. Okay, too slowly, but moving forward just the same. Also believe Medicare is paying. Not sure yet. Inform you as I learn more. Thank you. Says, fortunately, I'm not a 4, rather than a 3-3. Yes, I check myself. I'm a 3-3 as well. What are your thoughts on Medicare soon paying for this? So Medicare, has just started this guide program for people to support, and there are now, I believe it's 94 centers in the United States that will take guide, and actually Gray Matters in Florida is one of them. They will take Medicare as part of this guide program, but it's not yet doing some of the things that we'd like to do in RICO. This is your life. You're going to save hundreds of thousands of dollars of nursing home care by getting in early and preventing this. My argument is you should be able to save 90% of what an average Alzheimer person costs. So in the United States, before you die of Alzheimer's, the average you spend is $350,000, which is really sad. And some person wrote to us and said, no, we spent over $1 million with their mother. Nursing home care is expensive. So if you can avoid that, even though you may have to have some testing at the beginning that may seem a little expensive, yes, it is in the long run going to give you a tremendous savings of your synapses, not just your savings. Okay, husband here, homozygous for ApoE4, but normal MRI. Fantastic. Now, it says, oh, but it says it's still diagnosed with Alzheimer's. Okay, so he doesn't have a lot of atrophy yet. That's a very good thing. Now, when you say normal MRI, that sometimes means we didn't do volumetrics. So we read it as normal. Be careful for that. If it's normal volumetrics, then that's a good sign. People who have hippocampal atrophy are at an increased risk for going downhill faster. So definitely, it's something where this may be related, and I would see where where your husband's p-tau lies, GFAP and NFL. Jesse says, mother's 78, gone from MCI to decline that started with Graves' disease, now becoming demented, 2 ApoE3 genes. Yeah, and so we do see a lot of people who have other things, and Graves is not a common one, frankly. The typical thing we see is vascular damage or toxin exposure for those people who are ApoE3/3s. So let's see. Love to take this test. Been a health coach. Got to find a Recode physician in Scottsdale, Arizona. Waiting list is just too long. Okay, so one thing you could do, I would absolutely check and absolutely let's see where she stands and let's see if you can make things better. You can do a lot of the work on Zoom by finding someone who doesn't have to be in Scottsdale, Arizona. Or when you're visiting somewhere, you could start Pacific Neuroscience Institute in LA, or I'd have to look up to see what the closest ones to Scottsdale. But definitely there are people all over the country who are Recode trained. That would be fantastic. Yeah, would the test be good? Absolutely, because it should help. Again, it will help anyone with telling us, are you on the right track? Are you not on the right track? Are there things that have been missing? Still recommend activated lithium. So lithium orotate is the one that we often suggest. And by the way, yes, one of the things it does is it has a mildly inhibitory activity on GSK3 beta, which is the main thing that phosphorylates tau at that site. There are others, but so therefore, yes, I like the idea, and it will help bring this down a little bit. Now, again, you don't want to be non-physiological. You don't want to just suppress a test. You want to be doing this as part of making cognition better. But yes, some lithium can be helpful to bring this down. The next one says, anonymous, receive my test results all normal. Yes, we want to see more of those. Great. So I was more afraid not to take it. Very good point. Plan to follow the prevention protocol for life. Fantastic. Now, here's the thing. You only need to check this every once in a while. I say, 5 years until you get to 60, and then every couple of years after that. Anytime it starts to drift up, it's like I used to say, we're all playing chess with the devil, and we understand the devil's moves, what the devil can make better and better, and we can counter them. Now we can look inside the devil's mind and say, what move is the devil going to make next? Because we know our p-tau, GFAP, and NFL. So it's really a tremendous opportunity, and I'm so glad to hear that they were all normal. Let's keep them that way till you're 100. Next one here says 83. Does Medicare cover this test? Yeah, this is a great point. I'm hoping it will in the future. At some point, I hope it will. Currently, they do not. And we do have, yeah, so we do have a nonprofit that is trying to help people get the right tests. So we may be able to help with that. Next one here is from Paula, who says a 4/4, huge improvements since starting Precode. By the way, anyone who's a 4/4, please do Recode. Precode is for, if you're really asymptomatic and you have no family history and everything's great and, you're 35 years old, okay. But Recode will do much better for you in the long run. A 40+ point improvement on cognitive tests, hallelujah. We're seeing wonderful improvements in the trial as well. Mocha from 27 to 30, hallelujah. So yeah, so you are great, a great point. Now it says kidney stones, general anesthesia several times due to lithotripsy. Yeah, so I see what yeah, should you expect lower results? Probably not. This is probably not going to be a big issue. But if you've had a long time, if you've had over an hour under general anesthesia, you may get a little bump. But again, Julie has written a wonderful guide, and we've also have got something in the books for what to do with when you're going to undergo anesthesia, so that you can minimize the problem there. And again, congratulations, tremendous improvements, a perfect MoCA score with your ApoE44. This is the future. This is the way everybody should be. Okay. And one person says, why does your p-tau increase with weight loss? Great question. There's a lower blood distribution with the same amount of p-tau. So what you can do is actually take your old weight and your new weight, do the ratio, old one over new one, and multiply that by your first p-tau and see it should go up a little bit. But we're looking at more important issues now. Is it possible that p-tau is also in your adipocytes that you're now getting rid of? We know that you have toxins in those adipocytes. This is produced by your body as an antimicrobial protein. So I wouldn't be surprised if it's going around your body looking for microbes to kill. We don't know. It's early days. Dr. Frickman mentioned that there is a group now interested in what organs is this entering. So this is a fascinating area, and I think we're absolutely going to know more. Julie, in your group on apoe4.info, has anyone said, "Hey, my p-tau went up when I lost weight"?
No, it's still too new of a test, and
Yeah.
people are just getting their first one. We don't have two tests to compare yet. So,
Yes. Okay. And then they're asking about contacting Julie here. And I assume that they can do that through apoe4.info. They can also do it through Apollo, through Facebook, through any of those things to contact you. Then next one is asking about plasmalogens and Dr. Dayan Goodnow. Dayan is an excellent biochemist. So I think for the right people, what I usually suggest is check your status on the plasmalogen tests. Many people don't need them; they're already optimal, and then don't worry about it. But some people they will, and so then you want to do that, and also see if it works for you. One thing, we are entering an era of concern for me. We're having what used to be said to be there's nothing in the armamentarium, nothing you can do. Now it's huge and it's growing, but everybody wants you to buy the next thing, hyperbaric oxygen, $60,000. Oh my gosh, people cannot afford all this. So we have to look at what does the most without costing you an arm and a leg. And as Julie always points out, doing those basic 7 things really, really helpful and is not expensive. We're doing better and better in understanding. Then we can see what we can layer on top of that. But yes, more and more there are these things that are quite expensive that may have a big impact and may not. So you want to try one maybe and see if it's got a huge impact or not. Stem cells, another great example. For the right people, that's going to be the right thing to do, but they are expensive. And so you got to decide who needs it and who doesn't. All right. Scott says, Julie, you mentioned babesiosis. Was this a Lyme disease related co-infection? So just to say, well, Julie, you answer. I remember the story very well.
yeah, absolutely. I had Lyme disease when I lived in Georgia. I was treated for it with antibiotics for, I think, 10 days or 2 weeks. It took care of the Lyme, but it did not take care of the babesiosis.
Yeah.
So as I recovered my cognition, I was doing well for a number of years. And one day I went to Dale and said, I'm feeling bad again. Something's wrong. I mean, I felt really, really bad. And you connected me with an amazing practitioner, and my antibodies to babesiosis were off the chart. So I didn't just have a mild case,
Huh.
and a very severe case. So treating that was, another game changer. But you always say that treating Alzheimer's is a lot like peeling back the layers of an onion.
Yeah.
And as we age, we're just going to continue peeling back and finding new insults and new things, but we can address them, we can identify them, and we can get better now.
And because I'm not a big kitchen guy, what I actually say is it's like landing a plane on an aircraft carrier. Like you're making little adjustments here and there and here and there.
Yeah,
Because
exactly.
as Aida will tell you, I am not tremendous in the kitchen. All
We
right.
don't
So
want to kill onions.
I'm very good at popcorn. So
Oh, you're cool.
Uh-oh. Anyway, so let's do this. It's now I realize we're running out of time here. So let's do this. If you'll post these on Facebook, we can answer as many as possible and go through there. I appreciate all the fantastic questions. Again, we're excited about this because this is a new era. This can really help us to reduce the global burden of dementia. Everybody should know their blood pressure. Everybody should know their LDL particle number. Everybody should know their homocysteine, and everybody should know their p-tau, GFAP, and NFL. And there was a question I should mention. There's one more here about should I change from pre-code to recode when the p-tau turned out to be high? Absolutely. Recode will give you the best chance. That is specifically set up for reversal of cognitive decline. And make sure, to work with a good practitioner, good team. Let us know if there are questions we can address on town hall. Let's all work together to reduce the global burden of dementia. We absolutely can do it. And Julie, I think, is a wonderful role model. So, Julie, thank you so much, as always, for your great commentary and for your courage to get this. And you and I are both getting ours, so we can compare results and discuss what we can all do to make things better, have a great cognitive future for all of us.
Right.
All right. Thanks for the great questions. We'll see you next time.
Take care.
Bye-bye.
Bye-bye.
Thank you, Julie.